Good morning, I'm Mabel Jong. Thanks so much for watching the World Healthcare Congress Interview Zone. I'm here with Elizabeth Critch, who is the Executive Director of the National Center of Excellence in Women's Health at West Virginia University. And you're also chair of the conference, The Business of Women's Health. Good morning.
Thank you. Good morning to you.
Well, why the special need for outreach to women specifically? What is the center trying to do?
Well, the mission of the centers is to help improve the health and well-being of women across their lifespan, okay? And then we know that ultimately that will reach to families. So we think that the outreach component takes all of the components of the National Centers of Excellence Women's Health, and I think you've spoke to somebody. So the components are education and leadership and multidisciplinary health care and research, and then outreach. So outreach takes it all. You can do everything if you do it right. So what we do at WVU, and we're the only center out of all the 20 in the nation that has a statewide capture area, only one that's 100% rural. So we have some challenges. And in each of our communities, the cultures seem to be very different because it's so rural. So we go into communities and we build partnerships. And with those partnerships, they help us reach out to all those women across all socioeconomic groups. And by doing that, we know that by reaching to the women and through a grassroots effort, okay, I don't care really where you are, women like to talk, and we like to talk over coffee, and we like to sort of work through issues. So what better way of getting information out to those women and also finding out what is it that we need to know?
Okay.
Who better knows than the community?
What sort of attributes are unique from community to community?
What we find in West Virginia, and again I think it's different. It's different than what you'd find in an urban area, but probably similar too. But who do those women trust? So for instance, when I come into a community, I have a champion that will come to me and say, Betty, you know, we've heard about these women on wellness programs that you do, and we'd like you to come to our community. And I say, great. That person reaches into the community and finds the people that we need to help staff this partnership because they trust that person. So if Mary, who's, I don't know, owns a small business in the community, or is a teacher, or might even be the mayor of a small community. Some of our communities, one we started working with last year, has 250 people in the community. That's it, okay? Wow. Yet it's nestled in way southern West Virginia. That cell phone coverage is very difficult. You know, your GPS doesn't get you there. So if that person from that community center says, this is a great program, then they'll come. But if I go, or you went, so that's the difference. When we try to bring public health issues into communities as a nation, and we think, oh, you know, we have this mission, let's bring it in, and they will come, or they won't.
Right.
And that's what's different in each of these communities is how do you get them to come? It may be different. It is different. Any
solid data or proof that your work is making an impact?
Yes. We, you know, in the world of academics, we talk about evidence-based research, and we don't have that yet, but we do have a lot of more soft data. So we do evaluations, and people tell us through these evaluations that, you know, 90% of the people feel that as a result of this day, it's a one-day behavioral change approach to healthy lifestyles is what we do. We work through a book that we wrote with a behavioral psychologist that works through the 5 stages of change. And these women tell us, 90% tell us that they feel that they've had an attitude change. And you know you have to have that to have a behavior change. First you have to have that attitude change.
More of an open approach to hearing or to listening to what you're saying?
Right. Because, you know, what you're trying to do is affect a very small change. So maybe that small change might be, I'll eat a piece of fruit every day.
Okay.
Or I may start to drink some water, because it's amazing how many people don't do that. And in a state like West Virginia, not only do we have trouble with access to care, you know, health care, but we have access problems with healthy foods.
Healthy foods, right.
You know, last night I took a walk here and went down the street and was able to get a salad that, I mean, I would never see that in West Virginia a salad built like that I could have built like that.
Okay.
You know, with all kinds of greens and vegetables and that sort of thing. Even in Morgantown, where I'm at, it's hard to find something like that.
Okay.
Never mind in say, in Gilbert, West Virginia. That's not happening.
So is your work extending beyond just reaching the women in the community, but reaching entire towns of
Absolutely.
trying
Absolutely.
to make things, more healthy things available?
Absolutely, because what happens is when you build this community partnership, you're linking the women that you're trying to reach to the resources in the community, but you're also linking those resources. So even in a small community of, say, 250 people, in that small community, and then there's the surrounding communities, people don't know that the other ones are there. I can't tell you how often I go into a community and somebody will say, well, we don't have Zumba, we don't have yoga, you know, there's really no place to go and talk about just heart health. And then all of a sudden you have those people in the room. Mm-hmm. Yes, in fact, they are there in their community, and so now they know that they're there. Mm-hmm. So that's, I find that that's really huge, because what you're trying to do is, we try to do, is in the morning, the way our program works is that they have health screenings, and those health screenings are offered by healthcare professionals in that community, so that now women see these health professionals as not scary anymore. They kind of look like we do,
right?
Okay, because everybody's casual. And now, if they're comfortable with that, right, are they not going to be comfortable bringing their children? Are they not going to be comfortable bringing their husbands? And today, in the sandwich generation, it's so many of us are caring for our parents. So if you can get the woman comfortable, saying that this is no longer scary, then she's going to bring the rest of the family to this. So that's why reaching to women is so important. And if the family sees mom going out and walking, or mom picking up that apple, maybe not immediately is you know, little Johnny going to pick it up, but he's going to pick it up pretty quickly.
What are the goals of the center coming up? The immediate goals?
Our immediate goals are to really be better able to evaluate the differences that we're making. How do you really see that Sally, who we reached, say, in Gilbert, West Virginia last year, has made improvements this year? Now, I can tell if Sally comes this year, but to be able to quantitatively say that Sally has lost 10 pounds and now includes greens and vegetables in her diet is hard to do that, because of the constraints you have also of just being able to document and ask Sally.
Oh, right.
You know, and be able to publish that. But we want to do a better job at that, is how are we going to demonstrate that we're making a change more than just anecdotally. I mean, we know that each time we go back into a community, we have more people. And we know that we have more and more communities from across the state asking us to come. As a matter of fact, we're going to another part of the state, and we've been asked to come. The main person there is a person that works for the VA. So we're so excited, because we want to bring, we've been working very hard to bring a military piece into this as well.
Right. Okay.
I don't know if that answers that.
It does, it does. And is there, what is the big message that you've been leaving with people attending your panel?
That we want them to feel empowered. We want to give women the power to take charge of their lifestyles, because if they are empowered to take care of their own healthy lifestyle, then they're going to take care of their families. And women don't realize the power that they have. So we go in and try to show them that, you know, that you do this anyway. You know, you are that natural leader in the family. So let's honor that. Let's help you grow that. Let's help you see what that is. And by giving them a day that's just for them, all about themselves, where they can ask questions in a very safe, non-judgmental environment, that's what you're doing. And we do find that those women now do reach out into the community and do more things to become much more active. But it's about empowerment, because we've forgot how to do a lot of these things as women.
Well, thank you so much for the reminder today, Elizabeth.
Well,
thank you. Pleasure to speaking with you.
Thank you. It's great to be here.
And I'm Mabel Jong. Thanks for watching.